Deficit supply of oxygen to Delhi, where 12 people died on Saturday and 25 last week because of a shortfall triggered by the second wave of COVID cases, must be rectified on or before midnight on May 3rd. That's Monday, the Supreme Court told the centre. The top court also directed the centre to work with state governments to create a buffer stock of oxygen to be used for emergency purposes and decentralize locations of these reserves. Well, let's go across to NDTV's Vaidyanathan for more. And Vaidya, this has been the subject of a hearing by the Delhi High Court for over 11 days now, and now the Supreme Court telling the centre that they must ensure oxygen supplies in Delhi are met.
Actually, this hearing took place on Friday. At the end of the hearing, the judges said that they will upload order soon. So the order was uploaded yesterday late night. So the three-judge bench of Justice Dhananjay Chandrachud, L. Nageshwar Rao and S. Ravindra Bhatt has passed this order. It's around 64-page order. Basically, it says, number one, the deficit supply of oxygen in Delhi should be met by midnight today. So earlier they were said around 480 metric tons per day. That's the requirement of Delhi. But later it was increased to around 700 metric tons. So in its order, the Supreme Court said that there should not any be bickering. It should meet it. And secondly, as you rightly pointed out, there should be a buffer stock to meet the emergency, but it should not be kept at one place. It should be decentralized. And another interesting point is about the procurement of vaccines. The court said 50% will be central, why 50% to the state government. So procurement should be centralized, otherwise it will create chaos. On the pricing issue also, court has pulled up and questioned the center why there is a different pricing. Central government should procure it and distribute it. So these are a few questions probably the central government will have to answer, and the next hearing is on May 10th. Also, the court is saying that when you, what is the priority for vaccinating the frontline workers like who are working at the crematoriums? That's also one of the most important things. And court has appreciated the work done by the frontline workers, including doctors, hospital staff, and nurses.
All right, Vaidya, thanks so much for joining us. So with all those details, so not just oxygen, but also on the vaccines, the Supreme Court has given directions. Well, the low flow of oxygen caused 4 deaths at the Barwani District Hospital in Madhya Pradesh, which is being claimed by relatives of the patients who died. However, the district administration claimed that only 1 person died due to cardiac arrest, though relatives say the oxygen was turned off for at least half an hour before the supplies could be met again.
यहाँ पर अभी आधे घंटे तक ऑक्सीजन खत्म हो गई थी। मेरे बच्चे की सुबह से 94 ऑक्सीजन चल रही थी, एकदम से ऑक्सीजन बंद हो गई। आधे घंटे तक अफरा तफरी मचा करी हम बोला करे कि ऑक्सीजन चालू करो। मेरी गोद में मेरा बच्चा ऐसा तड़पा करा। ये इन लोगों ने कोई डॉक्टर नहीं और कोई नहीं, हमको यहाँ पर किसी ने हेल्प करी।
ऑक्सीजन लाइन बंद हो गया था, कम से कम आधे घंटे तक ऑक्सीजन लाइन नहीं चला और ऊपर मेरा पेशेंट उसी की वजह से एक्सपायर हुआ है ना। और यहाँ पे प्रशासन जो है सिर्फ मुंह दिखाने आता है। कम से कम नहीं करते 4 लोग एक्सपायर हुए हैं, जो कलेक्टर साहब बोल रहे हैं कि 1 हुआ है और वो भी कार्डियक अरेस्ट, वो झूठ बोल रहे हैं, उनको कोई खबर नहीं है।
ट्रॉमा सेंटर में ऐसी शिकायत प्राप्त हुई थी कि जो ऑक्सीजन का जो फ्लो है, सेंट्रल पाइपलाइन में जो फ्लो है वो फ्लो पर्याप्त नहीं आ रहा है। तो जैसे ही शिकायत प्राप्त हुई, तुरंत जो हमारे ऑक्सीजन मैकेनिक है उन्होंने 5 मिनट के भीतर आके उसको देखा और फ्लो को जो है नॉर्मल उसमें फ्लो को रिस्टोर किया। तो ऑक्सीजन का फ्लो कम होने से किसी प्रकार की कोई कैजुअलिटी नहीं हुई है। एक परिजन जो कार्डियक अरेस्ट थे, जो आईसीयू में थे, कार्डियक अरेस्ट से एक परिजन की मृत्यु हुई है, एक पेशेंट की मृत्यु हुई है, तो उनके परिजन बाहर आए थे।
Well, news from Delhi now, and the large-scale vaccine rollout for those between the ages of 18 to 44 is expected to start in a big way from today in Delhi. The Delhi government has identified 77 schools as sites for vaccination in the city, in addition to primary health centers, polyclinics and hospitals. Let's go across to Sukirti now for more. And Sukirti, even though this next phase of the vaccination, opening up to those between the ages of 18 to 44 began on Saturday, that time it was more of a symbolic opening. Now, finally, the doses have arrived. So in a big way, hopefully the vaccinations will take place today.
Well, yes, from today, the vaccinations are supposed to take place. The Delhi government received about 4.5 lakh doses already. If you look at the larger picture, they've ordered at least 67 lakh doses of each Covishield as well as Covaxin. Both of these vaccines, to a certain extent, their quantities have been received among these 4.5 lakh doses that we have as of this moment. And there are 77 schools across the city where vaccinations will be taking place, in addition to many private hospitals that are already doing it. For example, Max has at least 4 centers in Delhi, then 2 to 3 in the NCR region where carrying out vaccinations that started off on Saturday. So definitely for Delhi, this would be a big boost, and we would recommend to every 18-plus viewer who's watching this right now to book their slot up at midnight, around midnight for the next 3 to 4 days, and that is when people can book their slots for vaccination. They can make the search for their slot either pin code wise or according to them all the vaccination centers across the districts that are available, and where they can go in the next 3 to 4 days. However, one rider at this point is that all the government schools it shows on that for which the slots are open on CoWIN, it does not reflect which vaccine is being given there. But the slot availability and the dates, those are available for private. However, it does display which vaccine is being given there and what is the cost of the vaccine.
All right. Thanks so much, Sukirti, for joining us with all those details. So from today, the vaccination drive, they're really opening up in a big way. In other news, a complete week-long lockdown in Haryana from today as cases of coronavirus have surged in the state. Districts sharing the border with Delhi have seen the highest number of cases. The state reported 13,588 fresh infections along with 125 deaths. This took the state's overall caseload to 5,01,566 and 4,341 fatalities. All educational, training, coaching institutions will remain closed. All cinema halls, malls, shopping complexes, gymnasiums, swimming pools, entertainment, theatre, bars and assembly halls will also stay shut. Well, let's get you the election news now. Mamata Banerjee won a spectacular victory in Bengal, defeating the BJP in elections in the middle of this raging pandemic. Trinamool Congress won over 200 seats in Bengal's 294 seats, and the BJP appears set to finish below the 100 mark. The Bengal has saved India, is what Mamata Banerjee said, deriding the BJP for its big loss after a double-century claim. But Mamata Banerjee herself was defeated by BJP Suvendu Adhikari, who used to be her former close aide in Nandigram. The Trinamool, however, has said they will challenge that result.
Trinamool's Khela Hobe is now Khela Shesh for the BJP. And to Saurav Ganguly, apologies. But Didi is now the new Dada of Bengal. She has hit the BJP out of the field, all this sitting on a wheelchair, taking on the might of the BJP juggernaut, the Home Minister, the Prime Minister, et al. Today it was goodbye wheelchair, Mamata Banerjee back on her feet, and how. But for COVID, the street outside her home would have been a sea of green.
So we won more than 2 to 1 seat. That is a landslide victory, and BJP has lost the election, and they have played so many dirty politics, dirty tricks. And don't worry for Nandigram, forget one thing. For struggle you have to sacrifice something. I struggled for Nandigram because I fought a movement. So I have forgotten now. It's okay. Let the Nandigram people, whatever they have given the verdict, I accept that.
The cloud over Nandigram lingered late into the evening. After several flips and flops, Shubhendu Adhikari was named winner. Trinamool suspects foul play and may challenge the result. Meanwhile, a tweet of congratulations from the Prime Minister to the third-term Chief Minister. Some BJP leaders more gracious in defeat.
পশ্চিমবঙ্গে একটি সক্রিয় দায়িত্বশীল বিরোধী দলের ভূমিকা আমরা পালন করব। মানুষের কল্যাণে যেসব পদক্ষেপ সরকার গ্রহণ করবে সেই সমস্ত পদক্ষেপকে আমরা সহযোগিতা করব।
But it couldn't have been easy. The BJP threw everything at Bengal. 20 rallies by the Prime Minister and another one virtually, double that number by Home Minister Amit Shah. Muscle, money, manpower, ED, CBI, income tax, mockery.
Didi, oh Didi.
The BJP wanted Bengal, the final frontier ahead of the Uttar Pradesh Assembly elections and 2024. In fact, what does Mamata Banerjee's monumental victory mean for 2024? She has emerged as the voice of the opposition against the BJP. Congress, left decimated, will have to rethink. The NCPs, the ARPs and the DMKs are already doffing their hats to the 66-year-old street fighter who, after tackling COVID, must set her sights on Delhi. With Saurav Gupta, Sohit and Manish Kumar, Monideepa Banerjee, NDTV.
Now in Kerala, the incumbent LDF has bucked a 40-year tradition by getting re-elected. In an exclusive interview with NDTV, the Chief Minister said the ruling front's victory in the Assembly election symbolized Kerala's rejection of religious divisiveness, saying the BJP has no place in Kerala.
Pinarayi Vijayan led the Left Alliance to a historic win, breaking the 4-decade-old political jinx of the Left and Congress-led fronts alternating in power. In fact, the Vijayan government is the first ever in Kerala to be re-elected after a full 5-year tenure. It improved its 2016 win by winning 99 against earlier 91 constituencies. The Congress-led UDF won only 41 seats against 47 last time. And the BJP losing even its single sitting seat, not even the high-profile Metro man, E. Sridharan.
ഇത് കേരളത്തിലെ ജനങ്ങൾ LDFന്റെ ഒരു തുടർഭരണം ആഗ്രഹിക്കുന്നതിന്റെ ഭാഗമായി വന്നൊരു വിധിയാണ്. അതിനിടയാക്കിയത് ഒരു സംസ്ഥാനമെന്ന നിലക്ക് കേരളം വിവിധ മേഖലകളിൽ വലിയ തോതിൽ പുരോഗതി ആർജിക്കേണ്ടതായിട്ടുണ്ട്.
The left has attributed its unprecedented victory to its welfare measures, especially its handling of the COVID pandemic, ensuring an abundant supply of oxygen and keeping the death rate low despite a high number of cases. K.K. Shailaja, the health minister, won by over 60,000 votes.
Would you be the health minister? That we cannot predict, you know. The left front will decide that after the victory or after winning the election. During the hardships, how a government act, that is the most important question. We have so many challenges due to during the 5 years. One hurricane called Oki and 2 floods occurred during the season, and also Nipah virus attack and also COVID-19 attack. Everything occurred here. But what did the government did? But the government, under the leadership of our brave comrade Pinarayi, our chief minister, we were fighting against it with the help of the people.
For the Congress, the loss raises many questions, not least because of Rahul Gandhi's extensive campaign here.
We accept the verdict of the people of Kerala. It was unexpected. We thought that we will win the election, but unfortunately we lost the election. With humility, we accept the verdict of the people.
BJP, despite its campaign around Love Jihad, losing its sole seat in Thiruvananthapuram to CPM's Shivankutty. And young sitting Congress MLA Shafi Parambil defeated star candidate E. Sridharan.
With camera person SP Babu, Sneha Koshi for NDTV.
In Tamil Nadu, the DMK is set to return to power after defeating its main rival, the AIADMK, which has an alliance with the BJP. MK Stalin's DMK and its allies are leading in 149 seats and the AIADMK in 85. Sam Daniel reports.
celebrations at the DMK headquarters in Chennai began early, as trends and results showed a decisive victory after 2 terms in the opposition. The enthusiasm meant COVID precautions were forgotten, despite it being a Sunday lockdown in a state that's reporting nearly 20,000 COVID cases every day, over 14,000 deaths so far, and shortage of hospital beds and medicines.
Maybe in the coming week, because victory, the MLA should get their victory certificates and then assemble here, elect their leader. There are procedures. The government, the incumbent government should resign. The governor should call us and we will fix a date. And it is a vote for the change in governments in the state. People have wanted a change in the present government and they are totally against the government of India. And both the state and the central government had failed in controlling COVID. We will see that the situation changes and people get proper treatment.
The DMK win came from sweeping the Chennai zone that has been its stronghold, getting a majority of seats in the south where the AMMK split the AIADMK vote, and from the coastal belt. The AIADMK managed to get a respectable tally with seats in the party's stronghold in Kongu belt of western Tamil Nadu, from where Chief Minister Edappadi Palaniswamy won with a 30,000 margin, and also the one-year belt of North Tamil Nadu, thanks to the master stroke of EPS to grant 10.5% internal quota within the MBC reservation to the one-year community. Despite anti-incumbency, infighting within the party and the perception of being remote-controlled by the BJP at the centre, EPS has emerged as a mass leader even without the charisma of Jayalalitha or MGR. And this performance may even strengthen its hold on the party. The BJP, that was seen as being in the driver's seat despite being a junior partner, managed to win 5 out of 20 seats contested. The Congress did reasonably well in Tamil Nadu, getting 16 out of 25 assembly seats and the Kanyakumari Lok Sabha. Power has alternated between but stayed with the 2 Dravidian parties in Tamil Nadu, and this time too it's no different. Neither national parties nor new parties managed to make a dent. With Arvind Gunashekhar, Uma Sudhir and camera person Shah Vijay in Chennai, Sam Daniel, Find TV.
Time for a break. On the other side, the BJP retains the Sam. We still don't know who will be the Chief Minister. Welcome back. Now our exclusive interview with Kerala's Health Minister KK Shailaja. It's not clear though yet whether she will retain that portfolio.
One of the big, let me just say the stars of the Pinarayi Vijayan cabinet now joins me, KK Shailaja, who's been Health Minister through this very turbulent time of the coronavirus. Also known as Shailaja teacher. Thank you very much indeed, ma'am, for joining us. Congratulations. Firstly, I just wanted to ask you, I believe your own seat.
Thank you.
Your own seat you won with a huge margin, the highest, is that right? Or
Okay, in my constituency, I got a thumping majority, more than 60,000 votes. And that is a great victory, and our LDF and our Chief Minister also, he had won a very great victory there also in his constituency, and most of the LDF candidates won more than 25,000 like majority. It was a hard winning majority, we can say like that. A very good victory for the left front and continuation of the left front government in Kerala. That is a historical thing, you know.
No, that's 60,000 votes.
All these times, one after another, the governments are coming.
Yeah, 60,000 votes in and especially state like Kerala. That's a huge number. Congratulations for that. But just tell us, ma'am, you know, how challenging this was, because you were fighting the coronavirus. You remained one of the hotspot states. Even now, I'm just looking at the numbers. You have close to 16 lakh cases overall, 35,000 cases being added every day. And despite that, you managed to come back to power.
Okay,
how do you explain that?
I think the people know how we worked on. Yes, I know that the people can understand that how we worked hard throughout this 1.5 years on coronavirus outbreak, 1 year and 4 months. And Kerala had one of the long drawn pandemic. It started in January 30th of 2020 in Kerala, first in India we can say so, and we were fighting against that virus. The first part we flattened the curve totally. When the first curve occurred, we flattened the curve, and the mortality rate is below 0.5%. And the second wave occurred here along with other places of our country and throughout the world. And the first part we delayed the peak, and we can reduce the mortality and we can build up the health system and put this virus potential under health system capacity threshold. But the second time, it is just after the assembly elections, and there was some gatherings due to assembly election work, and the second peak occurred all of a sudden, a little bit earlier we can say so. But we worked hard. We are working hard to tackle that problem also. Actually, we increased the beds in the government hospitals.
Yes. Go ahead.
Go ahead, ma'am.
The
oxygen production, and in Kerala, the people are the people are getting beds and oxygen supply, ICU beds, ventilators, etc. But it is really threatening this time. The cases increased higher. But if the cases increased this much, our mortality rate is 0.4%. That doesn't increase this time also, because we are treating the people properly, and also we are keeping the elderly inside the home, and we are providing medicines for non-communicable diseases.
Right,
Also
so it's been quite a challenge.
Most of them we can save out of coronavirus.
But can I just ask you, you said that the second
that is
wave...
why people are thinking, and also...
Right, just 1 second, I just want to ask you, you said that the cases were starting to rise because of the election campaigning. Are you saying that the second wave in Kerala was one of the was the elections kind of triggered that?
No, I think election triggered that, but we cannot say because of election. But there are some other states, there were no elections. The behavior of virus is like that. The peak will occur definitely. 1 or 2 or 3 waves may occur throughout the world.
Right.
But due to election campaign and gathering of people, the curve occurred earlier. That is, I am saying.
Okay. But right now,
the rise or the surge occurred not only because of the election.
Okay, but right now, what are your worries? Because I mean, I'm assuming that you're going to be coming back as health minister, or regardless, what would be the big worry? You're saying that you don't have the kind of problem of oxygen that we are facing here in Delhi and other states. If I'm not mistaken, that's what you're telling me. You're saying that you don't have a problem of beds, but what about vaccines? Because lots of states are running out. Do you have enough vaccines, or is that a problem?
Yeah, I don't know whether I become health minister or not. Left Democratic Front will decide that. It has to be decided.
Okay, but about
we are,
vaccines?
Working now, and yes, the vaccine. The real threat is about the vaccine, we can say so, the real challenge, because in Kerala the serosurveillance study revealed that only 11% of the people in Kerala are infected by the virus. 89% is we can say susceptible persons.
Wow.
And if we got proper vaccine, we can save all these people in Kerala.
Right.
We can reduce the mortality even below 0.4%.
Right.
But we are not getting proper amount of vaccine. we demanded that for above 60 priority group, we want 50 lakhs vaccine. And the central government decided 45 above priority, and then we want almost 1 crore doses of vaccine. And when they declared, our central government declared above 18 and vaccine should given to each and every citizen, we should get more than 1.5 crores or nearly 2 crores of vaccine. But we are getting a little amount of vaccine from the center.
How much are you getting, if I may ask?
And the central government give us permission to purchase.
How much are you?
Yeah, we got already, we have got nearest 65 lakhs we had already got, and we give vaccination to more than 62 lakhs of people, and we have only with us below 4 lakh, 3 lakh and something that is in our stock, but that is for the second dose vaccine. We have to give the second dose. That is not very much. At once we should have to get 1 crore doses of vaccine.
Wow, so that's a huge gap. Big challenges ahead of you, ma'am. But, you know, all the best to you. And we continue to look to Kerala as being one of the states that's really at the front lines of fighting this virus effectively. Thank you so much for joining me, and congratulations.
Thank you.
Welcome back. Now, for the second straight day, Delhi reported over 400 COVID deaths on Sunday, while the positivity rate, that's the rate at which people getting tested for COVID receive positive results, has dropped below 30%. So that's some good news. The city also added 20,394 fresh cases. But every few hours, an SOS calls from hospital owners in Delhi saying that unless they're provided O2, patients will die.
More SOSs from Delhi's hospitals for something as basic as oxygen. With many hospitals helpless, families of patients have been left to fend for themselves.
2 दिन से हम एक सिलेंडर लेने गए हुए हैं, अब जाकर हमारे को मिला सिलेंडर। हॉस्पिटल वाले इसके अंदर बोल रहे हैं कि इनके पास ऑक्सीजन के अंदर दिक्कत आ रही है, इनकी सप्लाई नहीं चल रही है। अब जाकर हम सिलेंडर लाए, पूरी रात हमारे को रुकना पड़ा था उधर। सारा कुछ अगर हम नहीं करना है तो फिर हमारी सरकार क्या कर रही है इस टाइम में? 50 to 60,000 के अराउंड सिलेंडर मिल रहा है।
25-year-old Dhruv's brother is admitted at the Sehgal Neo Hospital in West Delhi. He stood at an oxygen plant for 15 hours to get this cylinder. 60 patients at the hospital are on oxygen support, and it is just managing to scrape through. The situation has turned so grim that at South Delhi Sama Hospital, relatives of patients were today asked to sign declaration forms saying that they will not hold the hospital responsible for any outcome, including death, of their patients that result from a shortage of oxygen. 30 patients in the hospital are on oxygen support right now. Dr. Anusha Gudmular, RMO of Sama Hospital, told NDTV, "We were compelled to take this measure because despite our best efforts, we are running low on oxygen supply. Patients who need 3 liters of oxygen are being maintained on 2 liters. Other hospitals too, like the Madhukar Rainbow Children's Hospital, Sitaram Bhartiya Hospital and Vimhans, sent out SOS messages and received new supplies just in time. On Saturday, 12 patients including a doctor died at the city's Batra Hospital simply because their oxygen finished with no resupply in sight. While there are 30 COVID positive children in Rainbow Children Hospital, there are 45 patients including newborns and postpartum mothers who are on oxygen support at the Sitaram Bhartiya Hospital. The Delhi government maintains it needs more oxygen than the centre has allocated it.
Out of those 18 states, 17 states got as much oxygen as they demanded, in some cases more oxygen than what they demanded for. The only state that did not even get 50% of the oxygen that it demanded for happens to be the National Capital Territory of Delhi.
Why would that be the case? I don't think it's anybody's contention that the government would deliberately want to do this.
I don't know, Vishnu. I'm not privy to that. That the situation is very, very precarious and very grim. We as a state government are raising an SOS. And we're raising this SOS simply because we are not getting oxygen supplies.
Delhi High Court had asked Centre to ensure that Delhi gets its daily supply of oxygen, and if this is not ensured, then the court would initiate proceedings against them. But here on ground, SOS calls from hospitals still continue, and the struggle for oxygen happens every hour. In New Delhi with camera person Manoj Thakur, this is Sukirti Dwivedi for NDTV.
Now, the deficit supply of oxygen to Delhi because of a shortfall triggered by the second wave of COVID must be rectified today or before midnight, is what the Supreme Court has directed the centre. The centre must prepare in consultation with states a buffer stock of oxygen for emergency purposes and decentralize the location of emergency stocks. Within 2 weeks, the centre must come out with a national policy on admission to hospitals, and it must be followed by states. Till such policy is framed, no patient shall be denied hospitalization or essential drugs for lack of residential proof. Also, the Supreme Court said the centre must revisit the protocols on pricing and availability of vaccines, availability of oxygen and essential drugs. Now, during this crisis, many in civil society have stepped in to help during the oxygen shortage. One such effort is Mission Oxygen, which was started on 23rd of April with the aim to rush supplies of oxygen concentrators into India and distribute them free of cost to hospitals. 250 startup founders have dedicated themselves to make this happen. On 30th April, Mission Oxygen landed the first consignment of oxygen concentrators, and it's supported by several foundations and individuals like Sachin Tendulkar, Shikhar Dhawan and thousands of well-meaning citizens. Well, to talk more about this, we're joined by one member, Rehan Yar Khan, managing partner of HARYANA Venture Partners. Thank you so much for speaking to us. First and foremost, tell us, how did this come about, this Mission Oxygen effort?
Well, it just happened impromptu on the 23rd. Actually, some of these founders were looking to make a donation. And when they went to make a donation, they realized that, their donation would be just a drop in the ocean, number one. And number two, giving money was of no value because there were no supplies. There was nothing you could do with the menu, with the money. So then they decided to organize the supply chain to import these oxygen concentrators. Within a week, which is on 30th of April, they managed to land the first consignment, distributed those to many hospitals like, NCB Hospital, Pentamed Hospital, and many other hospitals. And now what they've started doing is they've organized a consignment to land every 48 hours and distribute these.
That's amazing, a consignment every 48 hours. Tell us a bit about, the challenges that you face, because it couldn't be easy, to import these oxygen concentrators. You had to find vendors as well. Then, of course, there must be some sort of bureaucratic red tape that you had to also negotiate.
Sure. I think the biggest challenge was, of course, the flights into India, because flights into India, as you probably know, are cancelled. Civilian flights are cancelled, so we had to rebook it. The original target was to land them on Wednesday. They landed on Friday. So they got rebooked 3 times. Finally, a dedicated freighter had to bring these in. And now whatever is going to come is coming in on dedicated freighters because passenger flights are cancelled. So that is the biggest challenge. Yes, procurement has been a challenge. Because, the factories had to provide a short notice. Remitting the money out of India was a challenge. It takes 2-3 days to get that. You have to get the paperwork cleared. But we pretty much figured out this entire chain, and that's why now we're in a position to land this consignment every 48 hours. We've been well supported by fundraising. I think our fundraising now has reached close to 30 crores. A lot of people have been coming forward and just donating, many foundations. So that's very heartening. We hope to keep that fundraising going. It's only through that fundraising that we can continue to import these concentrators and give them to the charity and government hospitals where they are most needed.
Right. In fact, I wanted to ask you about how do you decide, Mr. Khan, where the oxygen concentrators are going to go? Because, there's just such a desperate situation across the country. I know here in Delhi, we talk a lot about these SOS calls coming in from hospitals every single day about running out of oxygen. So you can just imagine what it's like in other parts, in UP, Bihar, Gujarat, Punjab, etc. It's a terrible situation.
Yes. There's no perfect way to decide, where it goes. Unfortunately, we estimate that there's probably a shortage of about 300,000 of these kind of machines in India at the moment. And, we're only able to procure them in the thousands. There are a few other efforts on to also procure them, but they're all drops in the ocean. So, whatever you decide, is just not fulfilling what is actually required to maintain people on oxygen.
Right, and should there be any sort of organization or hospitals, etc., that are now looking to get these oxygen concentrators? Would your advice be to them? Can they reach out to you? Would you help guide them on how to go about this entire process? Because I do know there are a lot of groups that are still trying to do this.
Yes, of course. So we have a website, missionoxygen.org. So one is you can come and put in a requisition form in there. And we will include that in the charity quota from the money that we've donated, that we've raised. Secondly, if you're in a position, if you're a hospital that's in a position to buy them yourself, then let us know, and we'll help organize them from the supplies and land them in India and get them to you. So both avenues are possible. Our aim is to try and bring in as many as possible and get them into how many ever hands as possible, but only at the hospital levels. We are not doing any supplies, to people who want to use them at home. It's only for hospitals.
Right, and it's so heartening to see this effort. I think during this entire crisis, the way civil society, citizens have come forward, people, are trying to organize oxygen cylinders for others, medicines, hospital beds, etc. So it's very, very heartening to see, at least, as we're waiting for the government to ensure the supplies and fix whatever problems and obstacles they're having in ensuring oxygen to hospitals, that civil society has come forward in this manner.
Yes, absolutely. As you said, 250 startup founders, some of the best and brightest in our country, have virtually left everything. These guys are not even checking their business emails every day and are only focused on this. Tremendous effort from people, tremendous selfless dedication. It's been very heartening, even from the donation front. People have just come forward voluntarily. We haven't really run a major fundraising effort. People have just come forward from our tweets and social media posts and just contributed. People like Sachin Tendulkar, Shikhar Dhawan, Taapsee Pannu, and so many other people, not well-known people, have just come forward and contributed. It's amazing.
And finally, before you go, is there any issue that is still, a challenge that's troubling you? Any sort of, blockade that you're facing that, you want to request that if that could be looked into?
No, we've got that pretty much figured out. We've got the entire supply chain working. Like I said, the machines reach the hospitals. Patients are on them. Hundreds of patients, hundreds of lives have been saved. We've got that working. The only thing is we want the fundraising to continue and people to keep contributing to it so we can keep the supply going. There's a massive, massive gap between what can be supplied and what is needed.
All right. Well, thank you so much, Rehan Yar Khan, for speaking to us here at NDTV and telling us about this effort. And thank you to everybody who's contributed to Mission Oxygen and made this a possibility. Well, in other news now, UP Panchayat election results will be coming out. And remember, many states, including Bihar, in fact, postponed the local elections in the face of the pandemic. UP, however, went ahead. There were reports of several of those involved in Panchayat duties also falling sick to COVID, many dying as well. The Supreme Court, however, did allow counting to go ahead in UP. Here's a report.
Swarming crowds of people on counting day of UP's local body polls. While many states, including Bihar, have postponed local elections, the Supreme Court allowed counting to go ahead in UP on the assurance that all COVID guidelines would be followed. The reality is very different. Teachers' unions claim that at least 700 of their members on polling duty died of COVID during the four-phase election, and now on counting day, they are again at risk. At a counting center in Dadri, Greater Noida, 7 counting tables have been put in one closed room where poll workers count surrounded by candidates and their agents. The police is enforcing social distancing in the open-air courtyard.
कोविड महामारी को देखते हुए जो भी प्रोटोकॉल बने हैं उस प्रोटोकॉल का पालन करिए, मास्क को पहने रहिए, सोशल डिस्टेंसिंग का ध्यान रखिए.
They have fined 10 people for not wearing their masks, but the counting rooms are not in their jurisdiction. The polling official, Atul Soni, arrived 4 hours after counting was scheduled to begin, and then was evasive when questioned about why social distancing was not maintained.
एक-एक क्षेत्रों में 10 लोग 12 लोग जो है एक-एक पद के लिए खड़े रहते हैं, तो इसलिए थोड़ा सा बेहतरी हो जाती है. मौसम खराब हो जाए, बारिश हो जाए, तो बारिश हो जाए तो उसके लिए व्यवस्था नहीं हो पाती, इसलिए बंद कमरे में की जाती है. खासतौर से ये होती है.
Santosh Kumar, a poll worker at Balia Counting Center, is frustrated with being put at risk during this deadly second wave.
सोशल डिस्टेंसिंग का हमेशा कहा जा रहा है कि पालन किया जाए हाई कोर्ट से, लेकिन यहाँ कोई भी किसी तरह का पालन नहीं है। 2 गज की दूरी की तो बात छोड़ ही दीजिए, या 1 इंच की दूरी भी लोग नहीं बना पा रहे हैं।
Across UP, a total abdication of responsibility by the State Election Commission. No social distancing, few masks and no accountability. It is truly devastating to think of how much faster the virus will now spread. How many more deaths of poll workers and candidates will occur, many of which are already going unreported. With Sanjay Kaushik, Kamal Khan and Ajay Singh, Meher Pandey for NDTV.
Well, that's time for us to slip into a short break. More news updates on the other side. Stay with us. Our top story, the deficit supply of oxygen to Delhi, where 12 people died on Saturday, 25 last week because of a shortfall triggered by the second wave of COVID cases, must be rectified on or before midnight of May 3rd, is what the Supreme Court has said in an order to the centre. The top court also directed the centre to work with state governments to create a buffer stock of oxygen to be used for emergency purposes and decentralize locations of these reserves. Oxygen supply to the national capital has been the focus of extended hearings in the Delhi High Court as well. Well, let's go across to Vaidya now for more details. So, Vaidya, this order only came in last night, and it also talks about vaccine pricing. Tell us more, give us more details.
Actually, this case was taken up on Friday. After the long hearing on Friday, the judges said they will pass an order and it will be uploaded. This was uploaded in Supreme Court website late yesterday. Justice Chandrachud, Nageshwar Rao and Ravindra Bhatt passed this directions. It's a 64-page long order. Basically, it says that the deficit oxygen to Delhi should be supplied by midnight today. During the course of the hearing, it was said that around 480 metric tons is the requirement, but Delhi said that it has increased to 700 metric tons as on April 30th. So now finally the Supreme Court saying just fulfill it. It's the responsibility of the centre. And secondly, it said there should be national policy and admission of beds. Supreme Court pointing out certain patients have been turned away by hospitals, particularly Noida and Ghaziabad, saying that they don't have any local identity cards. Court said the centre should come out to the policy till such policy comes out and no patient should be denied admission. And thirdly, it says on the vaccine procurement as well as pricing also. Pricing, it said, why should be 50% should be bought by the states? It will create chaos. And centre should come out with a policy. It should buy itself and distribution can be decentralized and question the policy. But all these queries will have to be answered by the centre before 10th. On 10th, the court will take up the case again.
All right, Vaidya, thanks so much for joining us with those details. So a direction there by the Supreme Court that the oxygen problems in Delhi should be resolved by tonight. Now, the low flow of oxygen caused 4 deaths, however, at the Barwani District Hospital in Madhya Pradesh. This is being claimed by relatives of the patients who died, though the district administration says only 1 person died due to a cardiac arrest. But Dr. Pratik Soni, who lost his brother, claims that oxygen line was closed and it did not start for about 30 minutes, due to which his brother died. Another resident said oxygen had stopped for half an hour, and as a result of which many patients on oxygen support were left in danger.
यहाँ पर अभी आधे घंटे तक ऑक्सीजन खत्म हो गई थी। मेरे बच्चे की सुबह से 94 ऑक्सीजन चल रही थी, एकदम से ऑक्सीजन बंद हो गई। आधे घंटे तक अफरा तफरी मचा करी हम बोला करे कि ऑक्सीजन चालू करो, ऑक्सीजन चालू करो। मेरी गोद में मेरा बच्चा ऐसा तड़पा करा। ये इन लोगों ने कोई डॉक्टर नहीं और कोई नहीं, हमको यहाँ पर किसी ने हेल्प करी।
ऑक्सीजन लाइन बंद हो गया था, कम से कम आधे घंटे तक ऑक्सीजन लाइन नहीं चला और ऊपर मेरा पेशेंट उसी की वजह से एक्सपायर हुआ है ना। और यहाँ पे प्रशासन जो है सिर्फ मुंह दिखाने आता है। कम से कम नहीं करते करते 4 लोग एक्सपायर हुए हैं, जो कलेक्टर साहब बोल रहे हैं कि 1 हुआ है और वो भी कार्डियक अरेस्ट। वो झूठ बोल रहे हैं, उनको कोई खबर नहीं है।
ट्रॉमा सेंटर में ऐसी शिकायत प्राप्त हुई थी कि जो ऑक्सीजन का जो फ्लो है, सेंट्रल पाइपलाइन में जो फ्लो है, वो फ्लो पर्याप्त नहीं आ रहा है। तो जैसे ही शिकायत प्राप्त हुई, तुरंत जो हमारे ऑक्सीजन मैकेनिक है, उन्होंने 5 मिनट के भीतर आके उसको देखा और फ्लो को जो है नॉर्मल उसमें फ्लो को रिस्टोर किया। तो ऑक्सीजन का फ्लो कम होने से किसी प्रकार की कोई कैजुअलिटी नहीं हुई है। एक परिजन जो कार्डियक अरेस्ट थे, जो आईसीयू में थे, कार्डियक अरेस्ट से एक परिजन की मृत्यु हुई है, एक पेशेंट की मृत्यु हुई है। तो उनके परिजन बाहर आए थे।
All right, so not just in Delhi, but in other parts of the country, the oxygen crisis being faced. Well, to talk more about this, we're now joined by Dr. Sonia Lal Gupta, Director, Metro Group of Hospitals and Neurologist. Thank you so much for joining us this morning. Dr. Gupta, if you could first and foremost tell us, are you hopeful now with the Supreme Court directing the centre to ensure oxygen supply to the capital that perhaps, this day-to-day frustration that many of you are facing may get resolved?
Hopefully, Gargi, I think at this point we just don't know. Looking at the situation, this is not that one episode has happened, multiple episodes have happened. And being in the forefront, when we see that we've faced that situation ourselves where, you have 3 minutes of oxygen left and you're just standing there praying helplessly and you see the truck coming in. I mean, nobody can imagine the trauma, the mental trauma each person is going through at that time. So I think it's easier said than done, it's very easy to direct someone that this is you better do this. But the question is, what are the repercussions if it's not done? The repercussion is that people are dying, and that is just not right. So I think there has to be some strict goals by the central government. They have to look at the oxygen crisis. This is not the crisis we should be fighting. There's a lot more we have to do, not just to give oxygen to our patients.
Right, no, absolutely. And, people are dying outside of hospitals. Now you have people dying inside the hospital. What happened at Batra Hospital on Saturday, and before that, you had another hospital, Golden Jaipur Hospital, in which another 20 people had died. And what is really frustrating and angering is the fact that it's been over 12 days. This crisis didn't start just yesterday. It's been 12 days that you've had the national capital grappling with this crisis, a hospital sending out videos, SOS calls, SMSs, journals, getting them all the time. And it's been 12 days. I can't emphasize that enough, that the national capital has been facing this and we still haven't been able to resolve it.
Exactly. And I think that is where the problem is, and that is where everybody needs to wake up. It's not a matter of a day. It's an everyday issue with multiple hospitals, multiple lives on stake. And as you said, it's just not about finding a bed. Everybody, I'm sure, is getting 100 calls a day for bed. That's one part of the issue. The problem is once the patient is in, to make sure they're getting the oxygen, the treatment is another issue altogether. So it's a very, very helpless situation. And I think really at this point, it's good the Supreme Court is becoming vocal about it. So at least there's some awareness rising. But really, I think some strict action needs to be taken if the demands are not met. It's just not about a directive at this point.
Right, and Delhi is such that we don't have any industries. We can't requisition oxygen from we don't have any steel industries here or factories, etc. And we need to depend on the centre for getting it from outside. We're also joined by Dr. Nilesh Gautam, interventional cardiologist, SL Raheja Hospital in Mumbai. Dr. Gautam, if you could share with us what the situation is like there. At the same time the Delhi crisis began, the Mumbai crisis also began over oxygen shortage.
Good morning. Yes, I do agree, but here we were a little, I think about a week early or 10 days early as compared to Delhi. Yes, the situation is almost the same and similar, but at the SL Raheja, we have been sort of prepared and the crisis is being managed to its optimal, I would like to say that.
So are you saying that in Mumbai at least you're getting regular oxygen supplies?
Yes, from what I hear, at least it's better than what it is in Delhi. So it is not so bad, but we are managing to hold on, yes.
Right, and cases in Mumbai have been, coming down, and people are hopeful that this will turn into a trend. Of course, if it's just 1 or 2 days, we can't say. If you could tell us the latest that you're seeing there.
The trend is definitely positive. It looks encouraging. The number of admissions, yes, have gone down, but the crisis remains. The shortage of bed remains. But overall, the number of inquiries and the individuals requiring hospitalization and the positivity rate, definitely we at the ground level, what are seeing is going down. Thank you.
All right, so that's a positive, reports that are coming out from Mumbai. We're joined by Dr. Dhiman Kahali, Director, Interventional Cardiology, the BM Birla Heart Research Institute from Kolkata. Thank you so much, Dr. Kahali. You must be relieved that finally the elections are over and now everybody can get down to the business of handling this crisis, because we have been seeing the COVID cases in Bengal and in Kolkata just escalating.
Yeah, it's terrible actually in Kolkata now. Every other admission has been suffering from COVID, even cardiological admissions who has been suffering from acute heart attack. And because of different reasons, election here, there is no masking, big gatherings occurring, no social distancing. So this has precipitated the issue and the disease is rampant, but fortunately it's little less than the other parts like Mumbai, Maharashtra and Delhi. The death rate is also little less, but the numbers are rising, there is no doubt about it. But there is semi-lockdown by our Chief Minister, and our Chief Minister has been taking very positive steps. But unfortunately, across the country, like Kumbh Mela, and that there was 90 lakhs holy dips during the Kumbh Mela, and it has been criticized by all the top shots in the medical fraternity and also the different news channels across the globe. And
I can just imagine the frustration of you doctors, you know, watching such massive gatherings taking place at a time when you have dealt with this crisis for over a year now and are still dealing with it. Dr. Kahali, if you could tell us, we also believe there's a shortage of hospital beds there. Even in Kolkata, it's a desperate fight to get a patient into a hospital.
Yeah, there is definitely a lack of beds here also because patients are coming and every day there is a long queue in the hospitals and people are not getting beds at proper time. But we are managing the situation somehow. We are keeping them in the emergency department and we have got online registration and we are trying to accommodate each and everybody. Fortunately, majority of the patients are getting beds, and as I have been listening for the last few days in your channel too, and just now also that there is oxygen shortage in Mumbai, Delhi, but fortunately, mainly in Delhi, but fortunately in eastern part, as the manufacturing is here, the steel plants are here, like Durgapur steel plant, the ISCO in Burnpur, and there are several other facilities where industrial oxygen is generated. And as we know, that there is not much of a difference between industrial oxygen and the oxygen required for the medical use. It's almost the same. In industry, it is 99.5% oxygen, and in medicine, it is 93.5 plus minus 3%. So it's all the same. And fortunately, in eastern part, because of good management by our Chief Minister and also the local administration, and also good management by the CEOs of different hospitals, as of now, we haven't faced the oxygen crisis, and we have got the steel factories nearby. Like Durgapur is 200 kilometers from Kolkata, and I hope that the supply chain should be proper. Of course, there is semi-lockdown in our West Bengal, state of West Bengal,
right?
And we've been very cautious, and now Didi is also doing a lot of work to prevent the disease. And
well, it's good to know that you're not facing the oxygen shortage that we're facing, but the number of cases rising in Kolkata and Bengal is a huge worry. And yes, hopefully the administration will get down to the business of tackling this second wave of COVID. Dr. Sonia, another issue is that even in Delhi, we're seeing that new centers are being created, these makeshift hospitals are being created, but many people are asking, where is the staff? Where are we going to get all the doctors and nurses to run these centers?
Exactly, yeah, that's another problem. I think shortage of healthcare personnel has always been an issue from the beginning.
Doctors and nurses, and they are exhausted too, because for 12 hours they're with the PP, they can't drink, they can't eat, they can't go to the washroom. This is a terrible situation. But hats to them. Every day I give hats to them. The persons working in our CCU, that with PP they have been not drinking, not eating anything, and for 12 hours. But the workforce is getting exhausted. So what we have to do at a national level, we should have a disaster unit, disaster management team, and we should also see that we have extra doctors. The MBBS final year doctors, they are well trained, all of them. They are preparing for the exams. Their exams should be stopped, and they should be taken in the workforce, even in the rural areas.
Right.
Because the metros in Kolkata, we have sufficient workforce. But if you go little away, I think we need more workforce, more trained workforce, and the final year nursing students should also be taken. And the demand of the
I'm running out of time. I just like to get Dr. Sonia in also on this issue, and that's something that I've heard a lot from doctors of roping in the students. Dr. Sonia?
No, absolutely. In fact, we have our, we ourselves, our students are also in clinical rotations. We have a nursing college, and our students in the second year, third year, we've roped them in wherever we can. So definitely that is one solution. And I think eventually India needs to, moving forward, plan ways where we can train more people with simpler courses, at least to take care of basic management to deal with this issue. I think it's a national issue, no doubt.
Though right now, of course, it's the crisis at hand, and all you doctors, you raise the same issue of a centralized command, a centralized agency or centralized team panel that will just look into all these issues, especially the oxygen crisis that we're facing here in the national capital. Thank you so much, doctors, for sparing your time and joining us on the channel today.
Thank you very much.
Thank you.
Well, staying with news from Delhi, now let's focus on the vaccination rollout. And today, the large-scale vaccine rollout will take place for those between the ages of 18 to 44 years. Remember, it began on Saturday, but then it was more symbolic as Delhi was facing a shortage of vaccine doses. Well, let's go across to NDTV's Sukirti for more. And Sukirti, several schools have been roped in to act as vaccine centers. You're at one such school. Give us the details. What is it like?
Well, yes, Gargi, we are in Ayanagar in South Delhi. This is a government school. Rajkiya Bal Vidyalaya is what was appearing as a time slot on CoWIN for people who tried to book a slot in South Delhi at this particular vaccination center. So what we are seeing are the school building and the school premises. But here, as you can see, people who had a 9 a.m. to 11 a.m. slot have been waiting in queue. But the problem is that they are being told that the system here is not ready yet, and that is why they will have to wait. So 9 a.m. vaccinations were supposed to start, but many people have been waiting for very long. We'll try and get you a few voices. Sir, आपसे जानना चाहेंगे कितनी देर से आप लोग खड़े हैं यहाँ पे? बताया जा रहा है, अधिकारी कुछ बता रहे हैं कब तक वैक्सीन आप लोगों को लगेगी?
मैं आपको बताता हूँ, मेरा रजिस्ट्रेशन जो है 29 को हो गया था, तो डिस्पेंसरी का है हमारा, तो डिस्पेंसरी में मैं गया था, तो वहाँ पे उन्होंने बताया कि हो जाएगा। फिर वहाँ पे फिर जो है बताया कि केजरीवाल ने मना कर दिया है, 45 तक अभी होगा। फिर मैं वापस आ गया। फिर उसके बाद आज सुबह मैं 7 बजे डिस्पेंसरी गया था, वहाँ पे अभी 9 बजे के करीब वहाँ पे स्टाफ आया, तो उन्होंने बताया कि अब सरकारी स्कूल में चले जाओ। फिर मैं आया हूँ यहाँ पे, तो मेरे पीछे सारी लाइन लगी हुई है। अभी यहाँ पे आने के बाद जो है अभी जो यहाँ का स्टाफ है उन्होंने बताया कि अभी डॉक्टर आए नहीं है, और आने के बाद जो है ना शुरू होगा सिस्टम। वहाँ पे कोई वो लाइन की वो नहीं थी। यहाँ पे मैं गया हूँ तो उन्होंने बताया कि आप लोग पीछे चले जाओ। मतलब इनका सिस्टम नहीं है कि हम पीछे जाएं, कौन पहले आ रहा है तो पहले लगेगा, तो सिस्टम होना चाहिए। फिर मैंने यहाँ से शुरू करवाया कि यहाँ से आप ऐसे लगते चले जाओ।
एस्टिमेटेड टाइम आपको दिया है कि कब तक शुरू होगी वैक्सीन?
उन्होंने बोला कि अभी 2 घंटा लगेगा।
2 घंटा,
आधे घंटे पहले इन्होंने बोला था कि 2 घंटा लगेगा, डॉक्टर आएंगे और मतलब उसके बाद जो शुरू हो जाएगा। और दूसरी बात ये कि डिस्पेंसरी में 45 वालों का लग रहा है, तो उनको आधार कार्ड लाके उनको असिस्ट लग रहा है। अब वहाँ पे मना कर दिया कि आप सरकारी स्कूल में चले जाओ, तो 45 ईयर्स वाला भी यहीं पे आ रहा है। और यहाँ पे ये कह रहे हैं कि इनके पास जो है 18 प्लस का है, 45 का नहीं है, तो वो 45 वालों के साथ परेशानी है। पहले इनको बताना चाहिए ना कि 45 वाला यहीं लगो, 18 प्लस वाला यहाँ स्कूल में आओ। ये थोड़ी सी इनको ही नहीं पता है कि इनके पास ही रिपोर्ट नहीं है कि किनको 45 वालों को लगाएंगे कि नहीं लगाएंगे, 18 प्लस वालों को लगाएंगे। इन्होंने मना कर दिया, 45 वाले यहाँ मत लोगो लाइन में, डिस्पेंसरी चले जाओ। अब डिस्पेंसरी वाले बोल रहे हैं
जी, धन्यवाद सर हमसे बातचीत करने के लिए। सो गार्गी, द प्रॉब्लम हियर एट दिस पॉइंट वन, ऑफ कोर्स दीज आर पीपल हु हैड अ 9 AM to 11 AM slot. Many have booked on CoWIN, many others have tried to book a slot somewhere else. That didn't work out, so they've been led here. So all of these people who were supposed to get vaccinated in the 9 AM to 11 AM slot have been in queue for at least the last half an hour. They've been told that it will take at least 2 more hours before vaccinations can start here. So day 1 of vaccinations, we are hoping that these problems will ease out in the next few days, but at least on day 1 today you can see that the situation is not going to be that easy. There are people in queue and people really want to get the jab and leave, and nobody wants to be out in the crowd at a time when COVID cases are already rising. So definitely these are logistical issues that the government may have to face at least on day 1, and people with the 9 AM to 11 AM slot might be asked to wait another 2 hours in queue.
Right, hopefully that will be resolved soon. And Sukirti, I know you have a slot booked today as well, so hopefully you will manage to get it today. Thanks so much for joining us there with the very latest. With that, time for us to slip into a short break. More news on the other side. Stay with us.
लंग्स हेल्दी रखने का मुश्किल तरीका, और ये है आसान तरीका। हायर इन्वर्टर एसी का डुअल क्लीन टेक्नोलॉजी, अब हवा साफ, नॉट जस्ट ठंडा। हायर इंस्पायर्ड लिविंग। बदलते मौसम में अच्छी सेहत के लिए चाहिए स्ट्रॉन्ग इम्यूनिटी, रिवाइटल एज।
इसका नेचुरल जिनसिंग एनर्जी बनाए रखे, विटामिन सी और जिंक इम्यूनिटी बढ़ाए, रिवाइटल एज।
सबसे रिलायबल ब्रॉडबैंड जियो फाइबर।
एसिडिटी, गैस, खट्टी डकार, पेट फूलना और कब्ज, ऐसे में मेरी सलाह है आयुर्वेदिक मुल्तानी पचमीना। ये पेट की सभी समस्याओं में पूरी तरह आराम देता है।
ये महामारी की बला, खांसी सर्दी से सता, सर दर्द बदन दर्द, टेंशन में नींद ना गवा, संडू बाम लगा, महामारी में ये वरदान।
The important thing is this is not a society that translates words into quick action. So therefore, all that we can do is to support Kailash's initiative and provide whatever help we can.
जब मनी बैक वारंटी वाला वाटर प्रूफिंग हो तब इस मैदान पे खेल कभी नहीं रुकेगा। कॉल 80504 80504।
Now the police firing tear gas shells the cannon, but there is slight irritation. It's difficult trying to show you the visuals.
बहुत टफ था यार, सारे क्वेश्चंस गूगल लिए थे पापा।
एकदम इजी था मॉम।
एक्सक्यूज मी, कौन सी कोचिंग में डाला?
कोचिंग से निकाला, सोचिंग में डाला। टॉपर के लाइव क्लासेस, एडेप्टिव प्रैक्टिस और आस्क डाउट से स्टूडेंट्स की सोचिंग बढ़े, तभी तो वो टॉपर बने।
टॉपर, बेटर लर्निंग, बेटर रिजल्ट्स।
Welcome back. A complete week-long lockdown in Haryana from today. This is after cases have surged there, and districts sharing the border with Delhi have seen the highest number of cases. Well, let's go across to NDTV's Ghazali for more on this story. So, Ghazali, a week-long lockdown, and already there was a weekend lockdown in many of the cities.
Yeah, but it has certainly come as a surprise because the Chief Minister was quoted thrice in the last 1 week saying that he won't go for lockdown. But the cases were actually rising in Haryana, and 4 districts which form the part of NCR, Gurgaon, Faridabad, Jhajjar and Sonipat, they had seen a surge in cases in the last 2 weeks, after which lot of deliberation was done by the state government. They started off with weekend lockdown, then there was evening lockdown, and finally a full week lockdown by the government. Essential services have been exempted and SOP has been issued, and similar thing has happened in Punjab. Punjab is also, it's not terming it as a lockdown, but for a week till 15th of May at least, there is strict curbs have been imposed in Punjab, with all those essential services being exempted, but also curbs on travelling, curbs on timings, on non-essential shops and all. They have also been asked to close down till 15th of May, because both these states, very importantly, they are already facing the burden of health care, because patients from Delhi are moving towards Haryana and Punjab for treatment, because we already know that what kind of crisis Delhi is facing for the last 1 or 2 weeks. And essentially in Punjab, if we talk of, there is no vaccination, there is shortage of vaccination, no doses are being given to any age priority group, be it 45 plus or be it 18 plus. And at this point of time, both the states have confirmed, though Haryana has rolled out 18 plus vaccination, but at the time when both the states are facing influx of patients from Delhi and NCR region, at this point of time, if there is no vaccination and cases are surging, so that's a big concern for both the states right now. That is why both have opted for lockdown and stricter curbs for the next coming days.
All right, Ghazali, thanks so much for joining us with those details. Now, time for us to slip into a short break. On the other side, we'll get you developments in Bengal after Mamata Banerjee's victory.
What we know, Senior Chief Kelly is the third member of the Special Operations Unit to be attacked.
They better hope he doesn't survive.
They crossed the line. My wife, my family, they brought their war into my house. They had no right to take so much from me. They're gonna play by my rules now. No remorse.
Watch Tom Clancy's Without Remorse, only on Amazon Prime Video.
आप ही बता दीजिए असली कैप्टन कौन?
कैप्टन दही, जो टफ और शांगो।
करेक्ट।
आपको टफ और शांग कौन बनाता है?
अंडा।
तो फिर कैप्टन कौन?
अंडा। संडे हो या मंडे?
People still think, oh, it's been a year and it's not that bad anymore. It's still just as bad. But even if you think that, you're young and your immunity is great, it's really not. You could, even if you recover from it, you could hamper somebody else's health. So I feel that people really should just stay home, listen to what, the government's saying, just stay home. I know it's hard, but the more we sort of band together and listen to them, the quicker we can get over it.
Hi. Hi.
Hi.
Welcome to Mumbai Indians Live.
Go live with the Mumbai Indians. There are forces of nature. And then there are those who tame them. Ruling these forces is the Hyundai SUV line. Hyundai, India's #1 SUV maker.
बार बार होता बफर, फास्ट बॉलर लगता स्पिनर, या सुपर फास्ट वाईफाई के लिए क्या करेंगे? जियो फाइबर कर ले आओ, जादू के डिब्बे का मैजिक चलाओ।
Get 1 Gbps speed on India's fastest Jio Fiber. अब हर घर Jio Fiber.
This is NDTV, and you're watching NDTV 24/7.
Welcome back. Well, let's focus now on Bengal, where Mamata Banerjee won a spectacular victory, defeating the BJP in the election with over 200 seats. It was a resounding victory for her. Bengal has saved India, is what she said when she addressed the public and the media after the verdict had come in of over 200 seats. And but Mamata Banerjee, however, was defeated by the BJP Suvendu Adhikari, her former close aide, in Nandigram. Now let's go across to Saurabh to understand what happens next. Saurabh, Mamata Banerjee, accepted her defeat in Nandigram. She says, but we've had this victory in Bengal and we'll focus on that, and some sacrifices are made. Then there were indications that they may go to court. The Election Commission rejected their appeal of, a recounting. So what are you hearing now from the party?
Well, the line from the Trinamool that they've been saying is that, look, she hasn't accepted defeat. What she's saying is that she's accepted the verdict of the people, but she believes something fishy has happened there. Now, it's still unclear whether the Trinamool will actually go to court or not, or whether they will accept loss in Nandigram and move on. and perhaps Mamata Banerjee will take oath as Chief Minister and then get elected to the Assembly within 6 months, as is the norm. That's one possibility. The second possibility is that the Trinamool may move court over Nandigram and try and overturn the results. And that's something that's what they also have hinted at, because they said that, look, the election, we would announce the winners, and that's something that seems to that we will announce the winners, and then something fishy has happened, and then another winner was announced. So that is there. So obviously the Trinamool has been hinting that they will move court. They are not accepting defeat in Nandigram, but Mamata Banerjee seems to believe that even if that's the case, that eventually at a later stage that she has to accept defeat in Nandigram. She says that it's, well, sometimes you have to sort of sacrifice for the larger gain. And this, of course, she's talking in terms of strategy. Remember, the Trinamool was down and out in the Midnapur districts, when at the beginning of the election, Shubhendu Adhikari quit and went and joined the BJP. And everyone was thinking, what will the Trinamool do in Nandigram and especially Midnapur? But Mamata, shifting to Nandigram, seems to have definitely turned the tables for the Trinamool in Midnapur as well, where they seem to have done better than expected. And then several other districts they've done better than expected. So obviously what Mamata Banerjee is hinting at is that if at all she has to accept loss in Nandigram, then it would be for a larger cause, that is victory of her party.
All right, Saurabh, thanks so much for joining us with that. And probably she needs to get down now to the business of fighting this pandemic right now, and the COVID cases simply increasing. The numbers have just been released by the Health Ministry, and India has reported 3,68,147 new cases in the last 24 hours. So it's come down even more from yesterday. Remember, it had crossed 4 lakhs, and yesterday it came down to just below 4 lakhs, and now 3,68,000. Over 68,000 cases being reported. Deaths are 3,417. So deaths remaining above the 3,000 mark. The positivity rate is at 24.46%. With that, time for us to slip into a short break. On the other side, an exclusive interview with Chidambaram. Stay with us. Welcome back. Now, after the state election results yesterday, a dismal showing by the Congress defeated in Kerala and Assam, a poor showing in Bengal. So what next? We spoke to senior leader P. Chidambaram.
We've got P. Chidambaram with us, former Union Finance Minister, senior Congress leader. Thank you very much indeed, Mr. Chidambaram, for signing in. Just wanted to ask you, Mr. Chidambaram, because I know you'd want to weigh in on the kind of national impact of this election and particularly what it means to the BJP and its leadership. But just about the Congress, would this be overall a matter of concern for you that two key states, you couldn't wrest Assam from the BJP, you couldn't wrest Kerala from the left, even though Rahul Gandhi is an MP from Kerala?
Assam, we said we will try to regain power. In Assam, we never asserted that we will win. Because Assam, we were against a formidable BJP machine to which the person who went from our party added strength.
Yes.
So Assam, I think they tried their best. They got a significant number of seats, close to 50, but they lost. I think it's not a humiliating loss. It's an honorable loss.
Okay.
What worries me is Kerala. Every other election, the LDF wins, and every other election, the UDF wins. Ordinarily, we should have won Kerala this time. We didn't win Kerala, and that's a matter which I think the Congress High Command would have to investigate and examine very carefully.
And also Bengal, virtually zero, Mr. Chidambaram.
Well, I have a very different view of the Bengal strategy. It may not be proper for me to comment to the media on that. Anyway,
but
there was a strategy, it backfired completely.
Okay, give us some sense of what you think might be a better, or what could have been a better route.
You see, it was a fight between the BJP and the TMC in a highly polarized election. My experience tells me that there is really no room for a third person. Take Tamil Nadu. It's a highly polarized fight between AIADMK and DMK. The BJP had no business propping up the AIADMK and trying to run the show from behind the scenes. In Bengal, the fight was clearly between the BJP and the TMC. And yeah, well, according to me, the Congress should have thought through it more carefully. But I won't say any more than that.
Okay, well, you've also, you've given us a sense of, you know, what you believe was possibly an error of judgment by the Congress. Dorab Supariwala is also on the show, and Dorab, question for Mr. Chidambaram?
Mr. Chidambaram, two quick questions. One is, in Assam, you probably had the best alliance you had for a long time. You had the AIDUF, which had not tied up with anybody since 2009, and you got the Bodos to with you. Yet, you could not make the break. On the other end, Tamil Nadu, while you won, you probably had the best scoring strike rate you've ever had. I mean, what did you do right in Tamil Nadu? Because you got you got 16 or 17 seats out of 25 that you contested, which is a phenomenon, probably the highest strike rate of any party. In Assam, with a good coalition, how come it didn't work out? Can you explain both?
Tamil Nadu, you have explained it in your question. We had a good coalition. We had a strong party leading the coalition, and we accepted a number of seats that were manageable. We didn't ask for too large a number of seats, which we could not have managed. So we asked for a reasonable number of seats, and we got most of the seats in areas where we are strong, the southern districts and some part of the central districts. We didn't win in the western districts. We didn't win in the northern districts where we are weak. But fortunately, we took bulk of the seats in the southern districts and the central districts, and I was not surprised that we won. In fact, according to me, we should have won about 18 or 19 seats, but that's a chance you always take in an election. In Assam, the strategy was right. In Assam, the strategy was right. Moment the BJP joined with the AGP, the AGP has actually betrayed the people of Assam. The AGP, which started as a very provincial, very regional party reflecting the sentiments of the people of Assam, has actually betrayed the people of Assam. Once the BJP joined with the AGP, our strategy was pretty clear.
Right.
We had to put all the non-BJP parties together. We did the right thing. And I think they fought a brave campaign. The fact that they fell short is a fact of life. There's nothing to be disgraced about it or humiliated about it.
You don't, Mr. Chidambaram, you know, before we wrap, you don't believe, as someone who's been quite candid about almost an internal crisis within the Congress, that this is yet another alarm bell that many of you have been raising, especially to do with a certain drift in the leadership?
No, I don't think you can blame the leadership for a win or a loss in a state election. These are collective decisions taken by the leaders of Assam, the leaders of Bengal, the leaders of Kerala. Yes, of course, the leadership is the one that takes the final decision. But let me make it very clear to you that it is the inputs provided by the state leadership which ultimately leads to a decision. Okay. And I think in Tamil Nadu, we provided the right inputs this time. A small number of seats in areas where we are strong, and then go along with the DMK.
Okay. All right. Well, let's see, you know, how all of this plays out. But thank you very much indeed, Mr. Chidambaram,
thank you.
For
thank you.
joining us on NDTV.
Now, the BJP retained Assam, but no word yet on who will be the chief minister. Here's an exclusive interview with Himanta Biswa Sarma.
And another big winner, and this is Assam, where the BJP has also defied the odds and come back to power. And we have one of the architects of that victory with us, Himanta Biswa Sarma, senior leader of the BJP, key strategist. Thank you very much, Himanta da, for joining us. Congratulations to you. Himanta da, were you at any point ever worried when you saw that the Congress had put together a pretty effective coalition? They'd managed to get Hagrama Molihari of the BPF, your former ally. They had Badruddin Ajmal. They seemed to be running a fairly smart campaign, unusually for the Congress. Was there ever any apprehension?
I think we always feel that you can cobble any coalition, but with Badruddin Ajmal in that coalition, it will never be successful. So we were pretty sure from the very first that because of Ajmal presence in the electoral scenario along with Congress, Assam votes will be polarized and it will have lot of polarization. And we are ready for that, and exactly that has happened.
Okay, but when you say polarization, Himanta da, it's not necessarily as if the tie-up with Ajmal was the beginning of polarization. The BJP in Assam, much before these alliances were stitched up, including you, have made very openly, some would say, divisive statements where you're clearly saying that you're acting in the interest of the Hindu majority. You've described, the refugees coming in from Bangladesh. The Hindu refugees are the ones you want to protect. The Muslims are being called infiltrators. So were you not already guilty of creating polarizations and communalizing the electorate?
Basu, Basu, you know BJP stand. Having considered Pakistan to the Muslim majority, we do not want to consider Muslim migrant from Pakistan as a natural refugee. So I think that is the BJP stand from very beginning, and that is not a communal divide, because we have already considered our land for them to have their own country.
No, but that is that Himanta da, I don't even know if that's the BJP's official stand, because that is an openly communal stand. We are not a country. We are not Pakistan. We're not a Hindu Pakistan. We are governed by a secular constitution, which is home to all religions and all faiths. You can't say that we are a Hindu nation or some other nation. We are a secular nation.
Basu, this will be argued at length in the Supreme Court, but the primary basic feature is that you are secular because you are not going to discriminate it among any caste and creed to your citizen. But your secularism definition doesn't define that you will embrace Muslim refugee or Muslim economic migrant from another country. I think all these are going to be debated in the Supreme Court, and our views is very strong that we consider the people who are victim of the partition, because Hindus never wanted partition. So we want them to give citizenship those who are victim of the partition. So you have to clearly divide the line between the victim of the partition or the beneficiary of the partition.
Okay, I'll not get into this debate with you today because today is the day when you won and it's a big victory. But I do want to ask you though that you were not going to contest originally, and then you jumped into the fray, and obviously now that is the open question, that having won, is it clear that Mr. Sonowal is coming back as Chief Minister, or could it be you?
Home Minister Amit Shah has given various interviews to the national channel, and he has indicated that a chief ministerial candidate will be picked up post-election by the parliamentary board.
Okay.
I think we are waiting for their decision. People have just owned they will be in Guwahati by tomorrow,
right.
And whatever parliamentary party will take a call, we will follow that.
So it's not decided that it will be Mr. Sonowal. It's still open. Is that right?
Home Minister Amit Shah has said to an interview that that a chief minister candidate will be selected post-election by the parliamentary board. So that doesn't necessarily means that X will not be the candidate or X will be the candidate. I think that is the call which will be taken now by the parliamentary board.
And Mr. Sarma, because you know health is something that is under your watch, and we've seen what's been happening with the coronavirus, the entire country, including Assam. You made that very controversial statement where you were unmasked and you said there's no corona in Assam. Do you now, firstly, do you regret that statement, and do you now take it back and acknowledge that it is a big problem in Assam?
I think again I found Basu, that day when I gave that interview, that day COVID count in Assam was probably in the double digit. So on that day I have given that answer. That was the position. But I have immediately add another line in the interview that as and when COVID comes back, we all have to wear masks again. We have to we have to maintain social distance. So people are not talking about the second part of my answer. They are only focusing on the first part of the answer, which was based on the factual situation.
No, but Hemantada, the reason why COVID will rise is precisely because if people don't follow protocols like wearing masks. So it's not a question of, you know, when it flares up, you wear. You have to be take precautions.
Basu, let it be a bit scientific. So tomorrow in Delhi, the COVID count comes down to 10. Will you not resume your normal economic life? Will you still wear the masks which obstruct oxygen flow to your body? Today, what Israel and America is doing, they have said that mask is no longer required because vaccination is completed. So every answer has to be given on a factual situation.
Yes, but Hemantada, with all respect,
that day Delhi there was COVID. But I have given that.
But I'm saying we are nowhere near Israel or America. Our vaccination coverage is a fraction of our population.
Basu, let us not debate on that primarily because you have seen me wearing masks today.
Right.
Because that day, when I have given the interview, nobody in Assam was wearing masks, not even your own reporter. So that was the reality of that day,
But that's not a anyway.
If you would have been in Assam, you would have also removed masks for a sense.
No, I would not.
That was the order of the day. On that particular context.
Okay. Anyway, you're right. We won't get into too much of a debate over it because again, this is perhaps not the time. But you now do concede that it is serious because at the moment
I agree with you.
It's about 2.5 lakh cases.
Today, everybody
3,400 daily cases.
Today, everybody
and 1,330 deaths. So it's bad.
No, Srinivasa, Basu, I am one with you that today COVID situation has deteriorated. We have to vaccinate our people. Till vaccination is complete, we have to wear masks.
Right.
We have to maintain social distance. We have to use hand sanitization. And I am out and out telling people in 24 hours. That is precisely my job.
Okay.
And I am doing that.
Okay. Okay.
And you come to Assam and you see
right.
what we are doing in combating COVID situation.
Okay. Let me just ask you before we wrap, because you know, you are not just an Assam figure for the BJP. You have an important central role as well. West Bengal is your neighboring state. The fact that the BJP fought this huge campaign there under Narendra Modi's leadership, under Amit Shah's leadership, and lost. Do you believe, as we've been hearing, you know, quite a few voices now come out and say this is a big setback to the BJP and particularly to the idea that Mr. Modi can just on his own win elections?
No, give me just 2 minutes. That first of all, we have able to establish firmly BJP in the soil of Bengal. We could go from 3 to near about 80. We could defeat a incumbent chief minister in her constituency. I think those are the reflection of BJP, power of the BJP's Karyakarta.
Right.
I think it is not a time that TMC should celebrate. I think it is a time for TMC to introspect why a sitting chief minister has lost. Today, if you ask me to contest from any seat in Assam, I am not going to lose. I am going to win by minimum 20,000 margin. So this is a day when TV studios should discuss about Mamta's defeat and rise of BJP from 3 to 80.
My gosh, that's always provocative of you to say that that's the point of debate.
That is why we
not the fact that the BJP threw everything at this election and still lost. But anyway, fair enough. You're entitled to your view.
No,
Thank you very much indeed.
Basu, just a small word. You are trying to punish a student who is regularly going to the school and trying to improve his own record. But you are not trying to defame a student who has actually failed in the exam.
Okay. I don't know. I don't know if that the loss in Nandigram means that the entire exam has been failed. But anyway, always a pleasure.
Big
Himanta
thing.
Biswa.
A sitting chief minister lost. It is a big thing.
It is.
It is a big thing.
Well,
Thank you.
It's a big piece of news, and they are contesting it. Thank you very much indeed, Himanta Biswa, for talking to us. Thanks very much indeed.